Good evening, everyone. Can everyone hear me okay? Yeah, great. Good evening, everyone, and a very warm welcome on this very rainy evening to our first joint event with the Women Leaders in Health and Conflict Initiative and the Women Leaders in Global Health UK chapter. My name is Kristen Meager, and I co-lead the Women Leaders in Health and Conflict Initiative, and I also manage the Research for Health System Strengthening in Northern Syria project, which supports this initiative. Tonight, we are here to highlight that health, conflict, and climate are intrinsically linked, and regardless of where we live, they impact everyone, often with very adverse consequences, particularly as we see emerging compounding crises across the globe. None of this is new or groundbreaking, but how we choose to engage with it and create change to overcome these challenges can be. And together we can be unified and stronger and bring to the forefront voices that are often the most severely affected but are not heard. There are leaders and activists all over the world doing tremendous work, and while we acknowledge all of their exceptional efforts, we are focusing tonight's event on the work of women leaders, because there are still significant strides to be made in envisioning women as change makers. Tonight, we bring together a group of women representing their wider communities to reflect on the differences that they are making and enable us all to think more critically on what we are doing or what more we can do, while simultaneously promoting the power of women's agency. Before we move to the panel introductions, I will just go through some brief housekeeping and the outline for this evening. We will be taking photos tonight, and hopefully when you've registered, you got the correct coloured sticker. So if you have a red sticker on your name badge, then we won't be taking photos of you. And if you have not made that clear, please do let one of the organisers know. The panel will run until around 7:45, during which time we will have some time for audience Q&A as well. And if you, of course, do not have time to have your question asked, then we do encourage you to discuss this further with both the panellists and amongst yourselves afterwards. Some of you will have noticed that we have had a change in our lineup of speakers this evening. We were due to be joined by Michaela Loach, but unfortunately we found out very last minute that she was no longer able to join us. But I'm very pleased to introduce Dr. Alida Borges, who is a very exciting new addition this evening. So I will just briefly start with an introduction to our co-hosting organisations. So firstly, the Women Leaders in Health and Conflict Initiative, which is a network of women working within the conflict and the health domain in various countries. And it's our mission to achieve gender equality and leadership in health and conflict-affected settings to support the health and well-being of all of those affected by armed conflict. Because we know that women are at the forefront of improving health in conflict-affected populations through service delivery, education, research and advocacy. Yet, of course, they do remain disproportionately affected by conflict and humanitarian emergencies. I will now hand over to Emma, who will be moderating the panel and will say a few words on the Women Leaders in Global Health UK chapter. Thank you.
Thank you, Kristen. I hope everyone can hear me okay. I'm not sure if these mics are on, but please shout or put your hand up. No, you can't?
They're not on.
Not on? I don't know if we... You can hear fine? Can people at the back hear me okay? Yeah, I'm getting some thumbs up, so I think we're probably all right. Well, yeah, thank you, Kristen, and a really warm welcome to everyone this evening. Thank you for joining us, especially when it's such horrible weather. So my name is Emma Pension, and I'm the National Coordinator for Women in Global Health UK. So Women in Global Health is a women-led movement challenging power and privilege for gender equity in global health. And we advocate to try and redress the underrepresentation of women in leadership positions to support the realisation of gender-responsive health systems and gender equity in the health and care workforce. So our UK chapter was founded in 2020, and we're one of 50 chapters globally. And we're entirely volunteer-run, so it's with a huge thanks to all our volunteers who have made this evening possible. It's a real privilege to be joined this evening by our three wonderful panellists who are very generously sharing their time and experience with us. And as Kristen mentioned, we will have some time for Q&A at the end, so please do be thinking about what you might like to ask. So introductions. Salma Dodi is a researcher and DPhil candidate in international relations at University of Oxford, specialising in international security and global health with a regional focus on the Middle East and North Africa. And her research primarily revolves around the weaponisation of health in Syria and refugee access to healthcare and social services in neighbouring countries. So we're also very pleased to be joined by Dr. Aleida Borges, who's a research fellow at the Global Institute for Women's Leadership and a visiting lecturer at the African Leadership Centre here at King's College London. So Aleida leads the Grassroots Women Leaders research stream and the Changemakers programme at the Global Institute for Women's Leadership. And her research offers critical perspectives on grassroots leadership, women's rights, representation and participation, and youth politics in the Global South across Africa and Latin America. And also very pleased to be joined by Alicia Herbert, OBE, who is the UK Foreign, Commonwealth and Development Office Director for Education, Gender and Equalities, and the UK's Special Envoy for Gender Equality. So she's previously worked in academia, the World Bank, and in senior UK government positions in Mozambique, Sudan, and Nigeria. And Alicia has played a leading role in shaping international development policy and driving programme delivery and policy reform across sub-Saharan Africa and South Asia. So please share a warm round of applause to welcome our panellists this evening. So Salma, I'll come to you first. And I think the first question and what we'd like to hear in your mind is what you feel the primary issues are around gender equality in your area of work, particularly reflecting on your experience in conflict-affected settings.
Sure. So I do work primarily on sort of health security or lack thereof in contexts of armed conflict, and sort of looking at how different political, social, economic factors coalesce to fuel human insecurity. And while we usually think of conflict and climate change as sort of two different types of crises, they're very much sharing a very intricate and alarming relationship that we need to reflect on. So climate change exacerbates tensions, accelerate the escalation of conflict, and at the same time, armed conflicts sort of promote environmental degradation and resource exploitation. And so the repercussions of these two types of crisis and violence, especially when they occur simultaneously, are very much gendered. And that is the case in Syria, which is the context I am most familiar with. So while natural disasters, mass bombings do not necessarily discriminate themselves, they do operate against the backdrop of historical and political, social, economic inequalities that do. So women bear a disproportionate burden of the health impacts arising from climate change and armed conflict. Their ability to enjoy basic access to food, water, health services is severely jeopardized due to embedded gender inequalities that usually precede conflict. So for instance, looking at Syria, there are over 6 million people who are in dire need of humanitarian assistance, and over 74% of these are women and girls. They're also at heightened vulnerability of sexual violence and reproductive health risks, mainly due to early and forced marriages, which are kind of used as a coping mechanism to face financial hardships, to also mitigate reputational risks in contexts where sexual violence is obviously on the rise. Also, displacement and overcrowding exacerbate challenges to access reproductive care, including family planning, prenatal, postnatal care, and that is obviously quite, it is a complication obviously for women who are pregnant, especially as when we add climate change to the mix, we notice that weather patterns do impact the availability and quality of food, so that means that a lot of women are not able to access adequate nutrition, which obviously causes a lot of complications. And so all of these different kind of aspects of gender inequality make it so that women often find themselves reliant on aid organizations to access basic protection and basic assistance, In the context of conflicts, there have been several studies sort of studying the differentiated gender impacts, and it shows that women-headed households are twice more likely to report a complete inability to meet their and their families' basic needs. So all of that kind of ties into the lack of political representation and to discriminatory treatments that are experienced by women based on their gender, including with regards to property ownership, inheritance laws, and so on and so forth. So women whose husbands have been killed or forcibly disappeared do face the most kind of these discriminatory treatments, and not only cope with loss and grief, but also with the fact that they have to navigate a very complex system. So they're not only at heightened medical risk, but also stripped of opportunities to kind of be politically, financially included, and which is why it really warrants our attention and sort of reflection as researchers, policymakers, and advocates.
And what are your thoughts on the role of research specifically in advancing that nexus between health, conflict, and climate through a gender lens?
I know there's a public reluctance to kind of believe that research has a real and concrete impact on that, and I think my fellow academic colleagues would agree on that, especially as we tend to perceive it as being too slow, too disconnected from reality. But I really think that if we can pragmatically translate research into tangible policy actions, it can actually have a real impact in alleviating certain key issues. So the first way in which it can do that is obviously by identifying challenges and uncovering vulnerabilities before they actually turn into full-fledged crisis. So for instance, with regards to conflict-affected areas, studies on disease risk factors and on the spread of infectious disease allow us to kind of think of which vaccination campaigns to start, how to improve access to sanitation, and so on and so forth, in fear of possible outbreaks. Similarly, when we sort of study the relationship between climate and armed conflict, this allows us to sort of see which vulnerabilities can turn into conflict root causes and address them way ahead of time. So thinking about, for instance, disputes over water resources in the Nile River, and sort of looking at how we can have water management for our cooperation strategies before these grievances kind of crystallize and turn into conflict. And so that kind of brings me to my second point, which is informing policy decisions. So research provides critical data and analysis that can be used to kind of inform policy decisions at the local, national, and international levels by, for instance, assessing the evolution of conflict or climate change dynamics, kind of the obstacles to addressing these challenges, whether they're natural or man-made. We can sort of help guide humanitarian responses and provide the framework for political and diplomatic negotiations. And I think, for instance, just reflecting on the case of Syria, there have been lots of studies featuring heavy quantitative and qualitative research, really providing a platform for people who are affected to kind of themselves highlight the issues that they're struggling with the most. And that kind of enabled us to have critical findings that have been guiding and providing a very solid framework for humanitarian organizations. It also helped us kind of capture localized and contextualized gender dynamics, so sort of seeing how we can compile gender disaggregated data about the differentiated impact of either climate change or conflict or both on women and men, and sort of help tailor interventions accordingly. A third way is also guiding advocacy efforts, because findings can provide a very solid basis for providing structured, compelling, and evidence-based arguments. And again, I know there is a resistance in academia generally to sort of even talk about advocacy or activism because we want to maintain a sort of objectivity. But I think that scholars should not be detached from the realities that they seek to explain, but rather really try and improve it. And so I think that as researchers, we have sort of a moral duty to engage with policymakers, government agencies, international organizations, and so on and so forth, to kind of highlight our concerns in academic work, but also work in collaboration with these different bodies. And the last point I kind of want to talk about, and sort of also ties into that, is participation in different local and global initiatives and partnerships. So collaborating with international organizations like UN Women, UNICEF, and even participating in global forums like these that sort of join different stakeholders across the spectrum really allows for the exchange of best practices and the promotion of women's leadership on a larger scale, and it allows us to finally kind of bridge that gap that we constantly talk about between theory and practice. And similarly, collaborating with local organizations to help develop capacity building training programs and so on and so forth is very important to sort of help promote women's leadership and their inclusion. So those are obviously just a few of the ways that we can think about, and I think it's very important that we constantly take the time to brainstorm and reflect on the ways in which we can put our research to our best use.
It's really, really interesting, and hearing what you were saying about the importance of local and contextual women's leadership as well. I suppose, Aleida, brings me on to a question for you, and I know that you recently returned to the UK after some time in Malawi, and we'd love to hear a bit about that, and in your experience, how gender dynamics were manifested in some of that grassroots work and activism you were seeing, and what impact you think that has on our ability to really achieve climate justice.
Thank you. So as Selma said, researchers can be quite slow in terms of being able to come to things like that and produce, but I've been put on spotlight, and I literally arrived 2 weeks ago, and I'm already here, and hopefully we would summarize some of the findings that we had. So I had the privilege of interacting with both men and women during my fieldwork in Malawi, and it was interesting to see the challenges that were there in terms of the different interactions. And similar to other parts of the world and other parts of Africa, women were also disproportionately impacted by some of the challenges associated to climate change. Malawi is a country where 80% of the population dedicates to agriculture, so is employed by the agriculture sector. Many families depend on subsistence farming for their livelihoods, and at the same time, it's a country that has experienced repetitive incidents related to climate change, cyclones. It's not even news anymore. I mean, it's been affected by so many cyclones. And when these cyclones happen, women again are disproportionately impacted, not just because their livelihoods have been affected, but they've also been displaced. And then they end up in camps. And women tend to end up in camps more than men. And so they are disproportionately present in these camps. These camps lack basic amenities, and women find themselves there victims of gender-based violence. They can't access the basic things that they need, both from the perspective of food and being able to feed their children and take care of their families in that context where they are in camps, as well as just, sanitary hygiene and basic things really that can lead to health complications. So again, women are there in that space, and they are so significantly impacted by these changes, but they are not in places where decisions are made. So women are affected, there's wide recognition that that's the case, but when it comes to who makes decisions about what happens when a cyclone hits, how are we supporting the community, women are not called. It's still a very traditionally patriarchal society where decisions are made by men, especially when we look at rural areas. We still have that notion of that traditional chief, and decisions are made by the traditional chief. The traditional chief decides what happens, where resources are allocated, and oftentimes, the majority of the times, the chiefs are men, and women are not really called. And so when it comes to prioritization, it's not really what necessarily women need, but it's what's decided that those women need. And so it's a significant issue. And the few women who have, been quite strong in this space and have, taken on themselves to be there, they're faced with challenges in that a woman is not a leader, women's leadership is not recognized. This is a country that is one of the few countries in Africa where we've had a woman leader. We have Joyce Banda, who was leader of the country, but for those who know the literature, she experienced a lot of backlash, and when it came time for re-election, she was not re-elected, so she didn't have the trust of her people. And there was even that notion of the Joyce Banda effect, in that the fact that they had a woman leader actually was a disadvantage, because after her leadership, there was this notion that, you see, we told you women are not competent and they shouldn't be there. And so there's a lot of mistrust when it comes to women and their space when it comes to decision making. Things are changing slowly, and I was very encouraged by young people and young people's perseverance to be in that space, young women, creating organizations, and these are some of the organizations I interacted with during the 3 months I was there. And a lot is being done, a lot of work and a lot of energy, but it remains a challenge. And, there are many legal frameworks internationally that recognize that, if you're going to have a delegation, if you look at COP, for example, you need to make sure that women are in those delegations and they have to be part, but there's all sorts of challenges when it comes to their participation, because a lot of it is like, okay, we need to have the woman there, the woman has to be there, but what's her meaningful participation once she's there? And I think it's important to have women in those spaces, of course, we want to see them there, but can they make any meaningful impact? And I think these women want to make this meaningful impact, so they want to be prepared to be in those conversations rather than just be put there. And that's where a lot of the challenges are still. And so it remains the case that, women are disproportionately impacted. Women are recognized as vulnerable. I think Malawi is an interesting case in that this recognition is there. You speak to government officials, ministers, and they recognize this is the case, the statistics and data are quite clear. But how do we make sure that participation is meaningful? And so going back to that question of climate justice, how are we going to achieve it if the people most affected are often not there, and when they are there, we're not really sure of how they can really make a change? And so it becomes really challenging. And again, thinking of who should be in the table, I'm saying women, but young women, because Malawi, similar to other countries in Africa, has a population that is disproportionately young. Right? The average age in Africa is under 25 for sure, and so it remains also that same challenge that we need to ensure that young people are there, young women are there, and that they are part of the conversation, so that we can start to just have those conversations in a more meaningful way.
Absolutely. And you spoke a bit about why it's important to have women in those leadership positions in a meaningful way, and one of those reasons is about prioritization and what is then prioritized. And I suppose it's kind of the million-dollar question as well, is why else is it so important to have women in those leadership positions in order to really tackle the climate crisis and its root causes?
Sure. I think there were interesting examples that were given. I think we all know, I think everyone in this room understands why we need to have more women. It's, again, if you are disproportionately impacted. We know that if you don't have that experience, and it's not so much the person having the experience, but the experience being there, right? Can those experiences be reflected in the decisions that we're making? But there were interesting examples that came from fieldwork in that, people went to communities and they wanted to identify key issues that those communities were facing with, particularly communities affected by cyclones and different environmental episodes. And so they went there several times and they were trying to identify these issues. And so it was often men in the table because, you ask the people in the community that know, and it was always men. And so they felt that, okay, these are the things we need. And when they went back, they came back with the things that were identified. And I think it was a program of 3 years, and repetitively the problems were still there. And the chiefs were not understanding why the problems were not being solved, because what they were doing is identifying the problems on behalf of women, and then going back and telling the women, this is what you must do. So that wasn't solving the problem. And so they but surely suggest, should we bring a few women into the table and see, what they're saying, instead of listening from what they want. And so, progressively they brought women to the table, and they started seeing differences. And the chief started getting very agitated. Why didn't we identify these problems before? Like, why were we not in a position to highlight these issues when they look quite basic once you are in the room and you're having those conversations? And so they reported that eventually the chief realized, okay, it's important. If we can have just 5 of them, it's okay, not too many, but just 5, then at least we will get some of those perspectives. And again, obviously, those 5 are always selected by the chief, etc. There are other problems that surround the problem of representation. But, there was a recognition that once those 5 were there, at least there was some sort of outcome difference. And I think often it was reported to me in the interviews that there was a bit of convincing to do with the local chiefs in terms of why should you have a woman there? Because the husband should be able to speak to the needs of the household and the woman. But once, there was some, difference and tangible outcomes that were coming from these meetings and the presence of those women, it became quite natural that indeed when a meeting happens, we need to make sure that the five, it's always just five, are called and that they are there. So there is some progress in that. And I think a lot of, we talk about what difference does it make to have a woman? What difference does it make to have a young person? But once people have these individuals on the table and they can see that tangible presence, then it makes all the difference. But it goes back to that same conversation about what are people doing in the room. In the space of gender in politics, we've been talking a lot about the fact that, yes, you have the women in parliament and it's different bodies, but it's just having the women or also about the meaningful experience and aspects that are being brought to the table. And I interviewed women activists that have participated at very high-level events and conferences like COP, and they spoke about the difficulties of finding themselves at COP because, the international delegations tell them you need to have a woman, so they go and select the woman. And she's happy to be there, but we recognize that climate conversations tend to be very technical. And if you just come into the room and we're talking about adaptation and all these really technical words, and if you don't understand what that means, how does that reflect in your community and the priorities that you have identified, then how can you have a meaningful participation that really represents the interests of the groups that you came to represent in a very specific context, such as Malawi, right? And in as much as you know, for instance, that Malawi is one of the countries in the world with the highest rates of deforestation, that might not be helpful to that particular conversation that you're having, because how is that then going to be negotiated, discussed, if you're not really trained into the technicalities of those conversations, as well as negotiation skills and how to be there, how to use your voice. And there was an important question that was often highlighted again about funding. We want women to be present, but then even the international delegations, the women are expected to fund their trip themselves. So many challenges, and it's very clear why we need to have more women, because even if it wasn't just a 50-50 discussion, it's also the fact that we're speaking about them, so they should be there.
Absolutely. And Alicia, you've had a long and varied career working in development and gender. And I suppose we've heard about the meaningful impact of women's participation, and also from Salma about the importance of translating research into policy. And I suppose we're witnessing a rollback globally on women's and girls' rights. And what do you think we could and should do, both as citizens and as professionals, to be countering that trend?
Yeah, so and thank you very much for the question, and huge thanks for inviting me to be here this afternoon. Really enjoyed listening to what the previous panelists have said, and there's lots in common you've got, and I keep wanting to sort of almost kind of jump in and kind of support what they're saying. So we are definitely seeing an attack on the rights of women and girls. I think it's sort of almost kind of hiding in plain sight. What we are, is happening at international level, at the multilateral level, it's happening at the national level, it's happening at the regional level, and indeed it's happening at the local level as well. I think you just need to read, some of the more recent kind of documentation of that by people like Neil Datta, and it really gives you a sense as to what's going on. Now, none of that is new. Right? To me, this whole business of the kind of contestation that we've had, particularly in multilateral fora, that's not necessarily new. But what is new is how vociferous it is. What is new is how emboldened it is. What is new is how coordinated it is. And what's new is how well funded it is. And this is transnational. It's not just funding happening within particular pockets, but in fact, there are alliances being built across the world on this. And that sits as well within a particular geopolitical context. Yeah, because this is not, in a sense, women's rights and girls' rights are kind of being weaponized and instrumentalized for kind of wider global political objectives around instability, and hence, the whole piece online and in the digital space, in the virtual space as well. So it's happening in the real space as well as in that virtual space. So there's no doubt, I think, at least in my own mind and what we've seen, that women and girls' rights are under attack. And indeed, next week, when hundreds of people are going to come together, including heads of state, at the UN General Assembly, I think it's an incredible opportunity to think about, well, how do we use that, and get a sense of, to take stock on where we are with the SDGs, and how this context within which we're operating, what does it mean for the achievement of the SDGs and what we do moving forward. But coming concretely, responding concretely to the question that you raised, what are the sorts of things that I think we should do as professionals, as activists, as those of us working in development and diplomacy? Well, I'll just kind of offer up 3 comments on that, and I'm sure you've got other ideas and other suggestions coming from our colleagues who are here today. And the first one to say is that we must be in a space whereby we unapologetically champion the rights of women and girls, right? So wherever you are you working for a grassroots organization? Are you working for a national NGO? Are you working for a national government? Are you working in academia? Are you working for parts of the British government? Are you working in an international institution? I think unapologetically standing up for the rights of women and girls and defending that. We must have at least some red lines of which we're willing to defend and protect. I think that's hugely important. And indeed, that's very much part of and a key element of the strategy that we just launched on International Women's Day. We referring to the UK government, we referring to the Foreign, Commonwealth and Development Office. And a critical element of that is about standing up for the rights of women and girls. And we will do that in our positions on the UN Security Council, the Human Rights Council, that sort of thing, in the multilateral fora, as well as in many other spaces that we occupy as the British government. The second thing I would say is this whole business around coming together. Yeah, you can't, given the level and the depth of the coordination, given the amount of money that's spent on this, given how systematic this attack is, this is no longer a business of, sort of slightly sitting mealy-mouthed at the side, kind of thinking about what you can do. This requires equally, I think, a well-coordinated, well-organized, well-funded sort of response to this, but also being very, very savvy about the way in which you go about it. So I think it's about working with, if I take the example, for example, of the British government, it's about working with your traditional like-minded partners. We work very closely, for example, with the French, the Canadians, etc., the Nordics, but also thinking about the sort of non-traditional partners that we tend to work with. And I'm very open about that sort of thing. So very recently, for example, I was in South Africa, and part of it trying to kind of get a sense of what's happening in South Africa with respect particularly to gender-based violence. And one of the statistics that sort of stuck with me, and I always repeat, is every 8 hours, a woman in South Africa is killed at the hands of her intimate partner, right? So when you have a situation like that, and you have a response from government trying to sort of deal with this in the Eastern Cape and other parts. I was in the Eastern Cape where this is particularly prevalent. So you've got, within that context, you've got a very, very serious national problem. But what you do have in South Africa as well, unlike many other parts of the world, is a constitution, is a legal framework that provides protection. Yeah, but that's not enough. Of course, you've got to deal with other aspects of this. I mentioned South Africa, and I just sort of slightly diverted into that because, in a sense, if you work for example, the British government, it's not about the British government going in there and sort of trying to talk to a whole range of African countries about these sorts of issues on the rollback of rights. It's about how do you work with partners like South Africa, for example, who've got a strong constitution, strong legal framework, and who can play a role regionally across the continent and indeed internationally in order to do that. Because I'm not sure the extent to which this is being recorded, but in a sense, our legitimacy and our credibility as the British government in South Africa sometimes, it doesn't necessarily give us the platform from which to actually have those kinds of discussions, indeed in South Africa itself or other parts of the world. So it's working with the like-minded, working with the non-traditional ones as well. I think it's hugely important. But I think as part of that, it's not just about what happens in the sort of in the kind of donor world and the kind of government and the multilateral fora. I think in terms of working together, we also got to think about building or supporting women's movements. Right? So I was really pleased to hear about your work in terms of grassroots organizations and women's movements, because it can't just be from what happens at the top and what happens internationally and nationally. It has to be about really supporting women's groups, women's organizations on the ground who are feeling the implications of that backlash, and as well know the solutions and have ideas about how to actually to tackle this at various levels. So I think it's working together at that level, but also working together in terms of supporting grassroots organizations and the building of movements. And then finally, what I would say as well, it's about funding, and you're probably thinking, my goodness, how could someone from the British government who's just cut aid over the course of the last 3 years be talking about funding? Well, I am, unashamedly so, in the sense that, you know, where do we put our support as a global community? Yeah. So on the back of our international women and girls strategy that we launched earlier this year, we did make commitments, and we continue to make commitments to that. You know, as well, commitments to women's rights organizations, a new aspect of what we're doing, recognizing it's a sort of terribly underfunded part, it's a kind of orphaned part of the kind of gender agenda internationally. So we're putting funding behind that, and many other aspects of the policy that we've launched. But I just want to come back very quickly before I close to the business of, you know, sort of research and evidence and so, which is hugely important. Because in a world of, let's face it, where not only our aid budget, but aid budgets around the world have been under pressure, where the economic situation probably would mean, in not only in the UK, but other parts of the world, that those budgets will continue to be under significant strain. We need to spend every single dollar, every single pound in a way that actually makes an impact on women's lives, or has a greater likelihood, I should say, of having an impact on women's lives. And in order to do that, we need the evidence, we need that research in order to guide us as to where to spend that. So just in summing up, I will say, one, we need to stand up for those rights, and advocacy is important wherever you are. Two, it's about working together, both internationally, nationally, as well as from the grassroots piece. And then three, just think about the support that we can provide as well in various forms, not only me sitting here as the British government, but indeed how we work with others in order to really support efforts going forward. So those are the sorts of things I would mention.
Thank you. And last year, Alicia, you attended the Women, Peace and Security Forum, and research by the Women Leaders in Health and Conflict initiative indicates that this agenda could be strengthened through centering health as a neutral platform for peace building and uniting people across conflict lines. What are your reflections on that?
Yeah, absolutely. And I think there was a recent article, wasn't there? There was a recent Lancet commission and sort of, you know, expanded on that. And I suspect it's because, you know, we have a situation whereby it provides an opportunity for investment at various levels, and indeed to kind of build a social contract, I think, you know, at various levels, bring in issues on gender equality with those of health, and, you know, in order to make a contribution to building peaceful communities. But all of that, it moves slowly, isn't it? You don't kind of bring about that sort of change, you know, overnight. And why is it that this confluence and bringing these two things together may have some hope of making a contribution? It's because they're rooted in the sort of principles that promote human rights. And I think if it's rooted in that, then I think the likelihood of making a contribution to building peaceful communities, building peaceful societies actually increases. And, you know, what you do is build systems which are more inclusive, you know, economic systems, social systems, and political systems which are more inclusive. But as I said, it takes time to do that, because we're dealing with quite significant, in some instances, structural barriers. And it maybe takes us into the space of then when we're thinking about responses to crises, yes, of course, we have to mount a humanitarian response, but it has to be more than that if we are to begin to work within those settings in order to bring about that transformational change. Yeah, you've got to start thinking longer term. So yes, you have to respond right away, but what are the underlying fundamental issues and analysis that you've carried out, and then how do you begin to tackle that? So that's where I would leave that one. Thanks.
Absolutely. Well, thank you. And I think we'll probably now turn to some questions from the audience. So if you have a question you'd like to ask, please do put your hand up, introduce yourself, and also let us know whether your question is for our whole panel or for a particular panelist. I think we do have a roving microphone, but we might be okay without. So please go ahead. Should we go to the lady in the dress here?
Okay, hello, I'm Kaylee and I'm doing a PhD on the gender security gap, specifically looking at instances of domestic security in the UK, which have been improved by having female leaders. So I just wanted to ask the whole panel if there was a specific example you could provide where female leaders were most effective, and just, you know, a few thoughts as to why they were effective in that particular example. Oh, thank you.
So your question is an example of a female leadership being effective, and why do you think it was?
Shall we take another question as well to give our panellists some time for thinking? I think there was a hand up, just here, lady in red.
Thank you very much all for your very interesting presentations. My question is for whoever would like to take it. It builds on a little bit of what you all spoke about. I found the idea of cooperation when it comes to all levels, all the way from global down to local, very interesting. But one of the questions that arises for me is what happens when the priorities are not aligned and there is a very big difference in what different regions are pushing for. An example that comes to mind is within climate, there might be more of a push for the human resources and the human and the people side of climate and the global south versus perhaps specific goals in global north and some of the multilateral spaces. So I would be curious if you've encountered those tensions and perhaps how you would address those to be able to have that cooperation work more seamlessly.
Great. Perhaps we'll pause there and turn to our panellists. I don't know if anybody wants to jump in.
Yeah, I can try that. I can try the first one, and for some reason, I don't know why, but I just went back to, gosh, some work I did in the 90s, and just popped into my head when you talk about female leaders. I thought about, you know, when I lived in Ecuador, in the slum communities in Ecuador, in Guayaquil, in the 1990s, and this woman called Senora Engma. So we stayed at Senora Engma's for, you know, I lived in a sort of room at the back of her house while we were carrying out some work. And for some reason that popped into my head. I've met sort of hundreds of women leaders since then, but somehow she's popped into my head. And I was thinking, why? I don't know why it's popped into my head. I'll figure that out on my train journey back to Glasgow tonight. But why did I think that she was terribly effective? And what she was basically doing at the time, I don't know if you know Guayaquil at all, at the time, Guayaquil is now very built up, but at the time, Guayaquil was basically a community on a mangrove swamp, right? And what she was trying to do, it was an illegal settlement, essentially. And what she was trying to do is to bring services to the community, yeah? And my goodness, you know, the 5'2" of her was actually, it was a powerhouse. And why I think she was effective, one, because she was from within the community. She understood what was actually required. She understood what it was like to live there and to deal with and the daily struggle of not being able to access those services. Yeah, so she was credible within that context and therefore can represent quite credibly at various levels. She was politically savvy and had a lot of nous. So she knew who was who within the local authorities. Right? She understood the legal framework within which she was operating and how it sort of was bearing down on her and meant that she couldn't actually, and the community couldn't achieve what they wanted. And then use that in a way to leverage resources, right? To, you know, you still are in an illegal settlement, quote unquote, but you are trying to get services into that settlement. So how do you do that? How do you play the political system, essentially? And what it also required from her, which she had to negotiate with the authorities and within the community, is a fair amount of kind of compromise, right? And how do you phase this when people have a combination of a lack of water, lack of sanitation, lack of healthcare, lack of education, etc. So how do you face this? Which one do you go for first? How do you keep the community on side, but at the same time apply the pressure to the local government? So yeah, she's popped into my head, and I think that those elements of your credibility, right? Where do you get your legitimacy from? I think is hugely important. Secondly, you've got to understand what you're trying to influence and be savvy about it. I don't think you can necessarily be idealistic and purist about it. And then how do you leverage those resources and all the time keep that relationship going between, in this case, let's say the authorities or who you're trying to influence, and you're just keeping the people who you represent on side with what's going on. So I think those are the kind of key elements I would pull out of that in terms of effectiveness.
Aleida, Salma, I don't know if you want to share some thoughts.
A bit difficult to follow up from that. All of that, yes, definitely. I mean, I think if there was anything to add, I mean, from my experience, also passion and a vision. I had the privilege to meet this woman who was leading on this project in Malawi, working with the Ministry of Health. And so there was a hospital facility, and she is in the field. I think she's a doctor, but she wasn't practicing when we met. She developed a whole system around climate, nutrition, and maternal care within the hospital, whereby women, and I think particularly in the hospital facilities where she's based, a lot of the women come from rural areas, so it's a long distance, so they have to stay in that space. So make that space not just like human and with dignity, but also a creative space where women can sit and think about, how they want to lead their lives after the birth of this child. And a lot of that aligned with questions of sustainability, the climate, and nutrition, thinking about what's important for that child and how the diet of the child depends on also what's available in the community where this child is going to grow up. As I mentioned, in Malawi, families depend on subsistence farming. So for me with this woman, what was really interesting was indeed her passion and vision, because there wasn't any such project in Malawi, and she also didn't have an example from a different part of the world. And in fact, the different people she presented this project to all thought that she was mad, including her family. And so she had a very difficult time. She had to give up on a lot in her life, but she did pursue that passion. And now, I think 6 years later, it's a very successful model that is even funded by the World Bank, but a lot of sacrifice had to go into that because she had to create something that was completely new, because she had that passion in linking maternal care with farming, sustainability, and nutrition, which at the time was really visionary. And if she didn't have that passion, this project wouldn't be there for us to see. So sometimes it does take quite a lot of passion and vision for you to make it successful. And I think that it was because she was a woman, because I don't think it's that obvious.
Yeah, maybe just to briefly follow up on that, I also think that there are lots of grassroots efforts that are women-led. Just thinking about the Middle East and North Africa, and maybe to provide a very timely example, following, for instance, the earthquake in Morocco, a lot of the disaster response has been kind of supported by women-led initiatives who have been kind of trying to collect and distribute aid in sort of collaborating with the different villages that have been badly hit by the earthquake. And similarly, in other settings where there are active conflicts, women have been organizing to kind of explore alternative economic opportunities for themselves, to empower each other, to sort of try to build a community that is more resilient to armed conflict. I was recently attending Madania, which is a sort of initiative by Syrian CSOs that are trying to kind of reclaim political agency. And it was really refreshing to see the amount of women-led organizations, either working in the medical field, humanitarian field, sort of really making a concrete and tangible impact on other women's lives, and obviously on the entire community's lives. I mean, I don't think that women's expertise or skills should be circumscribed to gender issues. They're able, obviously, of improving the entire community's living conditions. And so I think that there are lots of initiatives that we should be supporting and sort of paying attention to.
Absolutely. And I wonder if there are any reflections on our second question as well around the challenge of perhaps gathering the collaboration you need when there are differing priorities. And Alicia, I wonder if you have any reflections on that in your time, especially in government, and you talked a lot about the other sort of working both with like-minded partners, but also perhaps less obvious partners as well.
So I didn't fully get the question. So you're saying the tensions between...
I have found that sometimes when it comes to the multilaterals or some governments, particularly in the global north, there is a disconnect between their priorities and the priorities of the global south.
Yeah.
Particularly, in my experience, has been around climate, particularly, let's say, adaptation efforts that focus much more on the human reality of the effects of climate versus let's fight the causes and the emissions. So that's my particular example. But I found, because since you said that cooperation is so important, it made me think of how can we kind of bridge that gap when there are those very clearly different priorities.
Yeah, and absolutely. And I mean, I think, yes, an excellent example of, that you've outlined there. I think that we just need to listen, probably listen more and listen more attentively, actually, because in a sense, in a way, you on both, quote unquote, both sides want to achieve the same thing and want to get similar outcomes, right? Let's say within the climate space, for example, it's probably about addressing the crisis, right, in some way, in a meaningful way, in a sustainable way. Ultimately, maybe you're heading towards the same goal. And actually, it's interesting that you asked that, because just today, and indeed next week, I'll be involved in a lot of discussions about how do you kind of bridge that gap? And I think one of them is about, kind of listening to the reality underground. I'm sorry, as much as I travel and, I do come from, I was born and grew up in a developing country. I'm afraid the last 35 years I've been here. So I do not have that experience. But I need to understand and listen to that and comprehend that. And then think about what it is that I would like to achieve on behalf of my government, and what is it that they're trying to achieve. And then start thinking about, what are those points at which we can probably connect and we can take things forward. And maybe sometimes just sort of say, no, I need to ditch my plan. Right? And we've had to do that in some instances, right? I've just got to put my plan aside. The time has not come yet. Yeah? And what we need to do now is to work with the grain, work with what's coming forward, and then we can move it. It's probably maybe not terribly related, but I'm again, just what's popping into my head is a whole movement now coming from the Global South, led by Mia Mottley, on the international financial system. And she's saying, sorry, this is not going to work. This is not working for us. And I don't care what you say in Global North, this is not working for us, right? And I have a plan. Have you listened to her speak? She is the most incredible woman. Oh no, but you go home tonight, Google it, go on YouTube, and you'll be mesmerized. And what she's saying is not only is she saying that the international financial system must change, but that she's got a proposal to make, and she's got the Global South behind, and we've got to do it. And what have we had to do? We've had to sit up and listen, and we are sitting up and listening, thinking about how do we work with it, because we've got to face up to the fact that it doesn't reflect the world and the diversity of the world. Yeah? It's no accident that the African Union was actually admitted into the G20 over the weekend. Yeah? So I'm just giving us as an example. It's not in the climate space, but whereby sometimes we need to listen. There are proposals coming from elsewhere, and we just need to face up to the truth and just think about, well, then how do we work with this? Because it's probably a very credible proposal that's been put forward, and then take it from there.
Now, I know we're slightly over time, and I don't want to keep people too much from refreshments, but maybe we can take another couple of questions, and then any questions we don't have time for, please do ask our panellists afterwards. So perhaps if we could come to this lady first here, and then at the front.
Hi, I'm Marjorie, a retired nurse and midwife, but activist on international and domestic issues, working with Syrian refugees at the moment. We have the UN Women, and we have the UN Women Watch. So I want to challenge the funding. What percentage of funding do those groups have? I also want to bring to the table that when we had COP26 in Glasgow, you can download even now the pre-read material. There is a page that says there is $70 trillion asset. I personally have got a Twitter handle, #ShowUsTheSpreadsheet, because I think we need to know where all this money is going, and it needs to be used much more efficiently and effectively. And please look at your title of today's meeting. There is one word there, conflict, that is costing us in health and climate. And we need leaders, please take this back to your chiefs as well. We need leaders that are mature in the wisdom of peace and working together as a global family, because this earth is crying out for us to start behaving ourselves. If not, we're going to lose everything. And it won't be through nuclear weapons. It'll be through our foolishness.
And then if we come to the front as well, and then.
Hi, my name's Adelphine Mudre Adebajo. I started a public health hub and I went to LSE and did a master's in health policy planning and finance. So my question is for everyone and for Salma in particular. Aside from speed, what do you think the barriers are affecting research from being translated into effective policies? And what do you think we can do as actors, activists, and the general public to make sure those effective solutions are done, and we can get policies that actually are implemented, that focus on women in equity, health, and conflict?
Thank you. Selma, I don't know if you want to start with the reflections.
Yeah, sure. I mean, that is a very interesting question, because I do think that indeed there is a genuine intention for a lot of researchers to sort of translate their findings into actionable policy recommendations, but there's often sort of a disconnect and failure to actually establish, create, and sustain dialogue between these sort of different actors. But I also think, as I said earlier, that there is some sort of reluctance also from the side of researchers to engage in that. So I think the main kind of areas that we should focus on is trying to come up with recommendations that align with political priorities. And so trying to establish a dialogue where researchers can sort of not just present their findings in ways that are compelling, but also see how pragmatically these can be translated into actual policy. So for instance, in the context of armed conflicts, there are lots that we can do and that we can think of, like institutional and like legal changes, having more solid policy frameworks. For instance, in the case of Syria with regards to inheritance laws, children custody, etc. But also, given the fact that it is currently a sort of a conflict zone, the rule of law is suspended. Violence has eroded social fabric, so it's hard to actually think about ways to properly change the law. It's not something that is easy to achieve, especially in the absence of a centralized and democratic state. So what we can then do is sort of try to think of different entry points, one of which could be society, so trying to promote societal changes, media campaigns, public awareness campaigns, sort of promoting women's inclusion, leadership, trying also to maybe engage with community and religious leaders that sort of know their communities and that can also help us kind of promote these values and ideals. And yeah, just trying to think of how we can better kind of highlight the importance of inclusivity, intersectionality, in ways that are actually achievable and feasible.
I think that's a really good question. Thank you for that. I mean, I think we recognize that just research is slow. It takes time for you to produce good work. And I think sometimes policymakers just struggle with that pace. But I think it's also possible, and that's what we try to do a lot at the Global Institute for Women's Leadership. We are based at the Policy Institute, so the name already says it. We engage a lot with stakeholders, government officials. A lot of the conversation in academia now is about that impact and how you can engage these stakeholders. So we have a track record that you can check for interesting sites in terms of what works. We actually even just got a prize. We got an impact prize recently with King's on work that we've done on the gender pay gap and how we've worked with authorities in Australia to change some of their frameworks on gender pay gap reporting through the project that we've done. And so there are ways, and I think it's all about engaging stakeholders and, as someone said, being out there and engaged with these actors rather than doing research. Because I think a lot of research traditionally also had that logic of being for teaching, right? So it's a lot about teaching and research and the intersection between the two, but also being open to research and the impact that it can have for policy. And I think an important dimension is also including policymakers in our grants, right? Because now it's a lot, if you look at what the grant applications are asking for, are you engaging with stakeholders, policymakers, grassroots organizations, schools, agencies out there? And the more that you do that, it becomes so clear how that then will have an impact. And I think the agenda is pushing us to do it, and I think it will happen so much more. And obviously you have actors like the Policy Institute and ourselves that are dedicated, and there's funding that is being put and made available for that to happen. And you already see that. It's just that, as with anything else, it's a bit slow.
Alicia, I don't know if you have any perhaps closing reflections on both our questions and comments there.
Yes, I think just on, I think that you're better placed on the, to respond on the research bit. We spend a fair amount of money, and we've got a fixed percentage of actually that's spent on research and evidence. You've got a big research and evidence department. That feeds our policy. It feeds our, the kind of what works piece that we do. And indeed, we've contributed as well to, the malaria vaccine, this kind of very long-term sort of, research and evidence building and investment that we've done as well. So it happens at various levels. I know it's slow, but there's a lot of urgent stuff in the world, so somehow we got to kind of speed some of this stuff up, right? So I'm one of those people on the other side sort of saying, yeah, I get it, but then I kind of don't, because, we got a bit of a crisis going on. So, sometimes you just got to probably work with some of the imperfect stuff and then keep going. It probably sounds like a bit of a cop-out, but I guess because the mic was a little close, I didn't get everything that you were saying. But I think you were asking, one of them is about what percentage of our funding goes to the Global South. Yes.
So what percentage of funding are they getting to be effective in the world? They must be getting some funding from somewhere.
Well, they certainly get funding from us, yes, and I think from many others. If we're talking about UN Women, for example, and I know we were very instrumental in setting up UN Women many years ago. So yes, we do fund them. We've had a situation, and it's plain for everyone to see in the last few years when we have had very significant pressures on our aid spending. That we did cut funding to UN Women, for example, but many others continue to fund them. We ride back there as well in terms of supporting them. The other thing as well that we work with the likes of UN Women is about exactly coming back to kind of research and evidence. Yeah. So how do you kind of take that to sort of say to UN Women, for example? I'm just using this as an example. If you are implementing these policies or implementing these programs with respect to, reducing or stopping gender-based violence, the British government, we invest quite significantly in that area through our What Works program, for example. You may want to kind of leverage some of this learning and this understanding into your program. So for us, the relationship, particularly in the last few years, yes, we've continued to fund them, their core funding, as well as operationally what they do in the field. But as well, we've been able, I think, as well, to forge a sort of broader relationship with respect to issues around, with respect to sort of research and evidence and sharing that and sharing knowledge, for example. I don't think it's just about funding for, be it UN Women or UN agencies. I think we've got to think much broader and deeper than that, in a sense of, capability and capacity within those organizations. We've got to think about the role that they can play. The UN more generally can play a role in many contexts and in many environments that we can't as a bilateral government. So how do they support that? But anyway, we could continue to talk to you if you're staying behind. Yeah, they do get support, but I think there are a number of other issues as well to kind of grapple with respect to some of those agencies.
Brilliant. Well, thank you so much, and we've run over time. I can still see some hands up. I think we'll probably close it there just so people have time to move back next door for some more refreshments. But please do speak to our panellists afterwards if you have questions that haven't been answered. So next door, there will be some food and drink. There are also 2 activities which we have set up, which we would really encourage people to take part in. So one of them is a space where you can make a commitment about your takeaway from this evening, perhaps what you've reflected on from our panellists, what you might do differently or take forward. And we also have room for a shared offers and asks. So the idea being that if there is something that you would like to ask for, and that might be support with a job application, or you have an idea for a project and you're looking for a collaborator. Make a note, we have some cards out, you can leave your contact details. And similarly, if you feel like you have something you can offer, perhaps you have the time to review someone's application, perhaps you have the time to look at someone's draft paper, make a note of that as well. And then before you leave this evening, take a snapshot of the board, and please do reach out to one another if you think there's an opportunity where we can do some mutual support and collaboration. So I'd like to close by saying a huge thank you to our panellists, to our audience, our question askers, and especially to everyone who's been working so hard behind the scenes to make today happen. And yeah, we can move back next door for some more refreshments. So please join me in a final round of applause.